Hi friends, good evening and welcome to my channel. Friends, through my channel daily we are seeing important points for exam. I hope these points are very useful for you people. So today's point, this is the video number 50 of the important point section, and we will see today's important point. The first point, the RH antigen was discovered in 1940 by Landsteiner and Weiner. RH antigen. And the next point, for effective sterilization, the pressure of steam in autoclave should be 15 IBS per inch square or 1.05 kilogram per centimeter square. That is the pressure. This is an important question. 1.05 kilogram per centimeter square, and the temperature should be 121 degree Celsius for autoclaving, and the pressure and temperature of autoclave should be maintained for 30 minutes. So the pressure and minimum maintained for 30 minutes. And next point, Dunlop traction is used in children with fracture of upper arm. Dunlop traction. And the very next point, fourth point, Byssinossis is also called as brown lung disease or cotton workers disease or Monday fever or mill fever. That is, Byssinossis is exposure to cotton dust. So this Byssinossis is also known as brown lung disease or cotton workers lung or Monday fever or mill fever. And the next point, hepatitis E virus is associated with highest mortality rate in pregnancy. And the very next point, sodium valporate is the drug of choice of absent seizure. And the next point, common site of pancreatic carcinoma is head of pancreas. That is the most common site of carcinoma of pancreas. And the next point, silvery white scaly patches are the characteristics of psoriasis. Is the main characteristics features of psoriasis, silvery white scaly patches. And the next point, barium solo is contraindicated in intestinal obstruction. Barium solo. And the next point, Adam test is used in scoliosis. That is, the main test is used in scoliosis is Adam test. Scoliosis means is a lateral curvature of the spine. So what we will do in this test is, we will advise the patient to bend forward and then we will look the back of the patient. We will stand behind the patient and we will look at the back. If there is, like picture we can see normal spine and deformity spine. So if there is a curvature is present, means Adam test is positive in scoliosis patient. And the very next important point, temperature of different solution. 12th point, for cold sponging, the temperature is 65 to 85 degree Fahrenheit. And for tepid sponging, it is 80 to 95 degree Fahrenheit. And for bed bath or sponge bath, the temperature is 110 to 115 degree Fahrenheit. And for steam inhalation, temperature is 120 to 160 degree Fahrenheit. All points are very important. And for enema solution, the solution for enema, it is 105 to 110 degree Fahrenheit. And for cis bath temperature, 110 to 115 degree Fahrenheit. And for warm soak, it is 105 to 110 degree Fahrenheit. And for hot water bath, for adult, it is 160 degree Fahrenheit. And for children, it is 115 to 120 degree Fahrenheit. And the blood is stored at a temperature of 4 to 6 degrees Celsius. And we will see the normal oral temperature of our body is 98.6 degree Fahrenheit or 37 degrees Celsius. And the axillary temperature is 1 degree less than oral temperature, that is 97.6 degree Fahrenheit or 36.4 degrees Celsius. And the rectal temperature is 99.6 degree Fahrenheit or 37.5 degrees Celsius. And temperature in different pyrexia we can see. First, that is 24th point, mild pyrexia, it is 99 degree Fahrenheit to 100 degree Fahrenheit. And for moderate pyrexia, it is 100 to 103 degree Fahrenheit. And for severe pyrexia, it is 103 degree Fahrenheit to 105 degree Fahrenheit, and for hyperparesia it is above 105 degree Fahrenheit. It is very important. And how to convert the temperature, we can see how to convert Fahrenheit scale to Celsius scale. The formula is Z is equal to F minus 32 into 5 by 9. And to convert Celsius scale into Fahrenheit, the formula is F is equal to C into 9 by 5 plus 32. C, that is Celsius, we can add. F means Fahrenheit temperature, we can add there. Herbarden nodes are seen in osteoarthritis. And the very next point, most common form of childhood cancer is leukemia. Leukemia is the most common childhood cancer. And the third ventricle of brain is also known as diacetyl. That is, the other name of third ventricle is diacetyl. And the very next point, most common type of brain neoplasm is glioma. That is, about 45% of brain neoplasm is glioma. And Dock's granuloma are seen in malaria cases. And Langerhans gene cells are seen in tuberculosis granulosus. That is, Langerhans gene cells. And the very next point, best test to confirm erythroblastosis fetalis is erythroblastosis fetalis in neonate is direct Coombs test. Direct Coombs test is the best test to confirm erythroblastosis fetalis. And electrolytes are absorbed in colon. Vitamin B12 is absorbed in ileum, and maximum water absorption occurs in jejunum. Electrolyte colon, B12 ileum, and water absorption in jejunum. And the very next point, the maximum absorption of fat also in jejunum. And bicarbonate buffer is the most abundant buffer in the blood. So the most abundant buffer in the blood is bicarbonate buffer. And hormone responsible for synthesis or secretion of milk is prolactin. So milk secreting hormone is prolactin, and milk ejection hormone is oxytocin. So the hormone responsible for ejection of milk is oxytocin. And the next important point, major caution in extracellular fluid, that is ECF, is sodium. And the major caution in intracellular fluid, that is ICF, is potassium. So ECF is sodium and ICF is potassium. This is also an important point. And the very next point, conduction velocity, that is speed, is maximum in Purkinje fiber. So the conduction speed, impulse speed, is maximum in Purkinje fiber and minimum in AV nodes. AV nodes means atrioventricular nodes. Minimum conduction velocity in AV nodes. And the next point, renal threshold of glucose is 180 mg per 100 ml. And normal glomerular filtration rate is 125 ml per minute. That is, GFR is 125 ml per minute. And high fat, next point, high fat and low intake of fiber may cause development of colon cancer. And the very next important point, the component of RL, Ringer lactate solution, is sodium 130, potassium 4 millimole per liter, chloride 109 millimole per liter, calcium 105, lactate 28 millimole per liter. This is very important. RL is an isotonic solution. And the very next point, patient with multiple fracture and fluid loss may develop and cause hypovolemic shock. So Ringer lactate solution is indicated in hypovolemic shock. Why? Means it can able to restore BP and peripheral circulation. So if the person is having hypovolemic shock due to multiple fracture fluid loss, we can administer Ringer lactate solution to the patient. Next point, type 1 diabetes mellitus is also known as insulin dependent diabetes mellitus. So type 1 diabetes mellitus, the other name is insulin dependent diabetes mellitus. And the one set of age of insulin dependent diabetes mellitus is before 35 to 40 years of age. And the treatment modalities of type 1 diabetes mellitus include insulin therapy and dietary modification. That is insulin dependent diabetes mellitus. So the treatment mainly insulin and dietary modifications are the type 1 diabetes mellitus. And In type 2 diabetes mellitus is also known as non-insulin dependent diabetes mellitus, that is type 2 diabetes mellitus. And the age of onset of type 2 diabetes mellitus is after 40 years. Type 1 diabetes mellitus means before 40 years. This is after 40 years. And the treatment modalities of type 2 diabetes mellitus is oral hypoglycemic drug, dietary modification and weight reduction. This is non-insulin dependent. Here patient is not giving insulin, instead of that oral drug, oral hypoglycemic agent giving, and dietary modification. Dietary modification means DM diet we are advising, and weight reduction are the management for type 2 diabetes mellitus.